Heart disease is often misunderstood. Many believe it only affects older individuals or those who visibly appear unhealthy. But the truth is, heart disease does not discriminate. It can develop silently, creeping into the lives of young, seemingly healthy individuals, often without warning. Take, for example, the case of Bob Harper, a well-known fitness trainer from The Biggest Loser. At the peak of his career, with a lifestyle dedicated to exercise and healthy eating, Harper suffered a near-fatal heart attack at the age of 52. Despite his healthy outward appearance, genetic predispositions and hidden risk factors played a significant role in his cardiac event. His story is a stark reminder that even the most active and health-conscious individuals are not immune to heart disease. Another striking case is the sudden death of professional basketball player Reggie Lewis at just 27 years old. Lewis was at the top of his game when he collapsed due to hypertrophic cardiomyopathy, a condition often overlooked in routine check-ups. His passing shocked the sports world, underscoring the importance of in-depth cardiovascular screening even for elite athletes. The reality is, heart disease is often preventable if we recognize the early warning signs and address common myths. By understanding how lifestyle choices interact with genetic risks, we can take proactive measures to protect our hearts. Myth number 1. Heart disease only affects older adults. Many people assume that heart disease is a problem for their later years. However, studies have shown that signs of heart disease can begin developing as early as childhood. Poor dietary habits, lack of exercise, and high stress levels contribute to an early onset of cardiovascular problems. Case study: the 28-year-old heart patient. One of the youngest patients I operated on was just 28 years old. He was a fitness enthusiast, regularly exercising, yet he developed severe coronary artery disease. Why? His diet consisted of high saturated fats and processed foods. Genetics played a role, but his lifestyle choices were the tipping point. Lesson: heart disease is not just for the elderly. Prevention should start early, focusing on a balanced diet, stress management, and regular health check-ups. Myth number 2. Normal cholesterol means no heart disease. While high cholesterol is a well-known risk factor for heart disease, normal cholesterol levels do not guarantee a clean bill of health. Cholesterol tests measure total cholesterol, but they do not differentiate between the different types of LDL, low-density lipoprotein, and their effects on the arteries. Understanding the dangerous cholesterol particles. LDL-C, the bad cholesterol that can accumulate in arteries. ApoB particles, a more specific marker that determines the number of cholesterol-carrying particles. Lipoprotein A, or LP, a genetic factor that significantly increases heart disease risk, even in those with normal cholesterol. Lesson: relying solely on cholesterol numbers can be misleading. Advanced lipid panels and genetic screenings provide a more accurate risk assessment. Myth number 3. Exercise alone can keep your heart healthy. Exercise is crucial for cardiovascular health, but it is not a magic bullet. Many people believe that if they work out regularly, they can eat whatever they want. This mindset can be dangerous, as diet plays an equally significant role in heart health. The hidden risks of overtraining. Extreme endurance athletes, such as marathon runners, can develop left ventricular hypertrophy. a condition where the heart thickens and struggles to pump efficiently. While moderate exercise strengthens the heart, overtraining without proper recovery can cause damage. Lesson: exercise must be balanced with proper nutrition, stress management, and sufficient recovery time. Overexercising can be just as harmful as being sedentary. The pillars of a heart-healthy lifestyle. 1. Nutrition, the foundation of heart health. Increase fiber intake, fruits, vegetables, whole grains, to lower cholesterol. Choose healthy fats, avocados, nuts, olive oil, over trans fats. Reduce processed sugar and refined carbohydrates to maintain stable blood sugar levels. Include anti-inflammatory foods such as turmeric, garlic, and green tea. 2. Sleep, the overlooked factor. Sleep deprivation increases cortisol, leading to higher blood pressure and arterial stiffness. Studies show that poor sleep quality can increase heart disease risk by 48%. 3. Stress management, the silent killer. Chronic stress leads to inflammation, high blood pressure, and hormonal imbalances. Mindfulness practices, such as meditation and controlled breathing, can significantly improve heart health. Social connections play a critical role in reducing stress and promoting longevity. For monitoring biomarkers, data-driven health decisions. Heart rate variability, HRV, a key indicator of stress levels and autonomic nervous system function. Blood glucose monitoring, high fasting glucose levels can signal insulin resistance, a precursor to heart disease. Waist to height ratio, a simple yet effective measure of cardiovascular risk. The link between inflammation and heart disease. Chronic inflammation, the hidden culprit. Many people do not realize that inflammation is one of the primary drivers of cardiovascular disease. When arteries experience chronic inflammation, they become more prone to plaque buildup and blockages, leading to heart attacks and strokes. Sources of chronic inflammation. Poor diet high in processed foods and sugars. Chronic stress and poor sleep habits. Sedentary lifestyle and lack of movement. How to reduce inflammation for a healthier heart. Eat anti-inflammatory foods like fatty fish, salmon, mackerel, leafy greens, and berries. Exercise regularly but avoid overtraining, which can cause oxidative stress. Prioritize sleep to allow the body to repair and reduce inflammation. Manage stress through mindfulness, yoga, or breathing exercises. Genetic risks versus lifestyle choices, what matters more? Many people assume that if heart disease runs in their family, they are doomed to suffer the same fate. While genetics do play a role, lifestyle choices have an even greater impact. Case study: the family with a history of heart disease. A patient of mine, a 45-year-old man, came to me terrified that he would suffer the same fate as his father, who had a heart attack at 50. However, after extensive testing, his numbers were excellent. Why? Because he had proactively taken care of his diet, exercised regularly, and managed his stress effectively. Lesson: your genes may load the gun, but your lifestyle pulls the trigger. Making smart choices can dramatically reduce your risk. Final thoughts on heart health myths. Understanding these misconceptions can empower you to take better care of your heart. By adopting a proactive approach, integrating a heart-healthy diet, stress management, and proper exercise, you can significantly lower your risk of heart disease and lead a healthier, longer life. At the end of the day, heart health is in our hands. Stories like Bob Harper's and Reggie Lewis's serve as powerful reminders that no one is invincible. But they also highlight an important truth: knowledge is power. The more we understand about heart disease and its risk factors, the more control we have over our well-being. The key to a healthy heart lies in prevention. Start today by making small, sustainable changes, whether it's improving your diet, getting better sleep, managing stress, or incorporating regular exercise. If you have a family history of heart disease, take proactive steps such as advanced screenings and genetic tests. Heart disease is not a fate, it's a battle that can be won with the right knowledge and lifestyle choices. If you found this information valuable, share it with your loved ones. Small changes today can lead to a healthier, longer life.